That first book that taught lateral violence to them, that was a new concept, a brand new concept to them. And they even talked about after that in their clinical environments when they had seen some of those techniques used. The second book, one of our objectives is to talk about coping, death and dying, cultural rituals with death and dying. Some of these students had their own rituals within their own family, but they had not necessarily thought about other patients and how they were going to deal with that. They will tell you right off one of the things that they were initially scared of was somebody dying on them, and how were they going to handle it. And they could vicariously have that experience through this book. And I think it developed them to only not face their fears, but also to be able to embrace their strengths and their weaknesses in death and dying before they even have to have the challenge.
I've been told that I relate to Miriam because I'm not the meaner part, but the caring part, because I do for anything for anybody.
So I think I relate to Haley because I'm fresh out of a construction work, got laid off, and so now I'm new into the medical field. And being as we've just started clinicals, I've experienced some of the situations like she experienced in the book with the confrontation from the older people, versus me being the new person coming in.
Well, in related with Mel and how she dealt with Devin's death, I went to my supervisor. I had a different situation like that, and I had to go talk to people, and I had to go talk to my supervisor to get her to help me kind of understand and how to cope with that, with death and dying, and that really helped me.
Well, I'd never heard of lateral violence. I knew it was going on after I got to reading it, but I did not know that's what it was called. But like I said, she has hit it right on the head, and it's all so true. And and it's taught me how not to get caught up in those types of situations, kind of.
Well, it definitely helps me recognize what's going on, and I hope that it helps me better prepare my reactions towards the things like that.
I think the way the friends, they went together when someone passed away, or like with Brad and the things that he done, the things that Miriam helped him with. I think that would teach you, like when your coworkers are going through something bad, to help them.
First of all, the way you test how they have done is obviously through either questions from the books. The books themselves have questions in the back to answer to make discussion questions even more with students. But their averages obviously are excellent now. They are using this text and learning from it. They can realistically see people they've already been in the work environment, either at old jobs or even in the clinical environment, and set them to characters. They believe the characters are real. And it's really exciting to watch them say, well, I think this character would do this next, or that character would do this. So they are following up on it, which I don't think, I know for sure you would not have gotten from a textbook chapter 2, let's talk about boundaries. This is a wonderful learning tool. You can use it to spur discussion that you can't get at end of the chapter questions in a textbook. You can also help students face their fears and their own challenges of going into the work environment using these texts. And ultimately, I think you make them a better prepared professional when they finish. This has been what we feel like an all-in-all encompassing event for them.
Yes, I am. I can't wait.
All right,
They can't wait. They want to know if book 3 they will be able to be a part of, even though they will be a graduate, and where they'll be. I didn't have to beg them to read them. I didn't have to assign certain pages to finish.
When I got mine, I picked it up and I started reading it, and I couldn't put it down. I read the whole thing in one day.